Hi, I'm Wendy, and I coordinate cancer research. I'm here to explain an important tool in treating cancer called the PET scan. The letters PET stand for positron emission tomography. A PET scan is a very sensitive test that shows how organs and tissues function inside the body. These scans help doctors treat cancer because they can track the activity of cancer and other cells. PET scans can be used to help diagnose cancer, prescribe treatment, and monitor the treatment's progress. PET scans work by measuring the level of glucose or sugar in cells. Different cells in the body take in different amounts of glucose depending on how active they are. Because cancer cells grow and divide so quickly, they absorb much more glucose than normal cells. For younger children and parents, a PET scan can sound a little scary. But don't worry, the medical team is there every step of the way. They will explain the process and tell families what to expect. A child life specialist or nurse will explain the procedure in child-friendly language. The PET scan machine looks like a giant donut with a tunnel in the middle. The patient lies on the bed and slides inside the tunnel. A technologist will be there to make sure the child is comfortable and in the correct position. While the scan is underway, the technologist will be nearby and able to see, hear, and talk to the patient. To prepare for the test, patients should not have certain foods and drinks or exercise strenuously several hours before the test. That's because these activities can affect the scan readings. About an hour before the scan, the patient receives a type of glucose with a special radioactive chemical called a tracer. The tracer emits a subatomic particle called a positron. This tracer helps the PET scan machine locate the glucose. PET scans are painless, but the patient has to lie very still. Patients may get sedation medicine to help them sleep through the process. Or a child life specialist may work with children on relaxation techniques to help them stay still. Within a few hours after the test, the radiation will be out of the patient's system. Again, this radiation amount is very small, but patients and families should ask their care team if they have any concerns. Families should find out the results of the PET scan in 1 or 2 days. PET scans are often combined with a CT scan, which takes different kinds of pictures. These images give doctors in-depth information. Most patients and families find that PET scans are one of the easiest and most routine elements of cancer treatment. And as always, remember that we are here to help you face pediatric cancer together.